I have a small scar that's about 5 inches on the top of my head. The scar is very thin, and I was just wondering how many sessions I might need to fill it. Would the grafts take okay on the scar?
I mean, if you take a look at my site, there's some there's a one patient on there. He had scar tissue right over the whole side of his head. He was burned and had skin grafts, which is very similar to transplanting into scar tissue. And we basically transplanted the whole scar, and he did great. I mean, grafts. There's a few things that we do differently in scars. One is that when use tumescence or saline, and we put less adrenaline in, just because there's a little bit the circulation isn't quite as good into scar tissue. We also don't plant quite as densely as we would into normal skin, again because of um, and we usually leave the grafts a little bit more chubby with a little bit more fat around them. But other than that, I mean, if you take those precautions, the results are fine. I like we've had good growth into scar tissue. Now, how many sessions would it take? Because we don't plant quite as dense, usually it takes a couple of sessions to get adequate density in a scar.